South Shore's morning news rolls on. Great to have you here, and it's the final Wednesday of the month, and we have, as always, our special in-studio guest in this segment, Renee McInnes. Renee is the CEO of CROI Health, CROI. Yeah, that's the name you want to let you know about and get to know that name. Renee, good morning.
Absolutely. Good morning. Good to see you.
Good to see
Hope
you.
you had a great new year.
I know, yeah. This is our brand new first segment of 2026.
Yeah, exciting.
And lots of new things going on, right? I've seen, love the logo, love the colors.
Yep. Lots of rollout on the messaging and just reminding people CROI Health, formerly known as MVNA and Hospice, still the same company. Nonprofit, independent, led by a fantastic board of directors and leadership team.
Still the same great people.
Same the great people, yes, just a new name, that's all. And today I have a guest.
Yes, and who do we have over there next to you?
Yes, Dr. Chekas. Dr. Chekas is our hospice medical director, overseeing hospice and palliative care. Dr. Nick, I call him, but Dr. Chekas. And I'm going to let him tell a little bit about himself and why he joined the organization at CROI Health.
That's great. Dr. Chekas, good morning to you.
Morning. Thanks for having me.
Great to have you in studio, and great to meet you. And tell us a little bit about your role and your background.
Yeah, so I'm a pulmonary and critical care physician by training, and I was actually in the intensive care unit at South Shore Hospital for the last 6 years until I joined CROI Health in December.
Okay.
And, throughout my career, I think helping patients and their families navigate challenging end-of-life circumstances has been a passion of mine and something that I've been focused on. And I have been excited to come to CROI where I can approach that from a little bit of a different angle than in the intensive care unit.
Oh, wow.
Yeah,
that's
and
wonderful.
it's so critical. We work really closely with South Shore Health's team, their palliative team. I know that our COO, Kate, had Dr. Breslow on to speak with you. And so Nick is very, works very well and has worked alongside Dr. Breslow. So what we can do is really provide palliative care for patients with serious illness and hospice care in the community, working directly with our healthcare systems, hospitals. And so it's a great collaboration, and it really, what it does is it really helps the patients get to the right care setting at the right time, so that we're working with their team, so we get those patients out of the hospital to where they want to be, really, which is home.
Yeah. That's what's so important, and I know that's what's so important to you, Doctor, right? And that's what kind of, I know drew you to be a part of CROI Health.
Yeah, and, I think in the intensive care unit, all too often we see situations where families will say, I don't know what my loved one would have wanted. Like, we never had that conversation. And you get it, because no one wants to talk about end of life.
No.
But, I think in the ICU, those end up being these forced, rushed decisions in the heat of the moment, and trying to bring those conversations into the community to really let people express their wishes and kind of have choice about what end of life might look like.
And that I guess ties into why it's so important to have these discussions earlier. What great decision did you make when you were under stress or in a short amount of time? Think about anything in life, right? Those decisions tend to be the wrong ones,
right?
Or the ones that you wish you could go back and change, right?
Right, exactly. And I think, Dr. Chekas' relationship with the physicians in the community and the health systems is very important, to work with their physicians, patients' physicians, to really discuss future state, end-of-life care, and what they really want and what that looks like. Because sometimes it's, like you said, it's in the emergency room or it's in the intensive care unit, and no one's really had time to have these conversations, and it's not something that the patient really wants to bring up and discuss. So it's really important, I think, nationwide, people are talking about this. We really need to have more connection with, I think when Dr. Swords was here with me, we talked about more connection with the primary care or the specialists, so that we can really identify these patients' needs early on and not have these crises. It also saves overall healthcare dollars. So Yeah.
Do you think we are making some progress in getting better in having any of these conversations?
I think we are at times, and
Yeah.
I think it's it's maybe a little less taboo than it used to be.
Yeah, that's it.
And I do think it is. You see, it's so much more peaceful for families when they come in and say, "Oh, we had this conversation, and I know that Grandpa wouldn't have wanted that."
Yeah.
Or he would want that, and I want to do these things.
Yeah, it makes it so much better when you can say it with confidence. And we always want to do what is best for our loved ones.
Yeah.
Right. And I think as part of our, palliative team with our nurse practitioners and our nurse practitioners working in hospice, an important role of the medical director, which is why as we grow, we needed to bring on someone full-time to really support that growth, is education and working with not only the nurse practitioners, but the nurses and the families and patients to really continue that that education, because messaging is so important.
Yeah, it really is. And I know, Dr. Chica, as you were saying, you're really excited to be a part of CROI Health and wanting to serve the community. I understand you live locally, right?
I do, yeah. I live in Hingham with my wife and 4 kids. And, that's something that's always been really important to me, is being able to work and serve in the community that I live in.
Oh, that's wonderful. Yeah. And to be part of a great organization, as we know, just recently rebranded, but a lot of history and reputation with now CROI Health, right?
Yep.
Yeah. And, CROI's been here for 100 years now. And it's,
Wow.
A full service organization where between home health, palliative, and hospice, we really try to serve the whole breadth of the community.
Absolutely.
That's
And working
amazing.
with our community partners, which we always say, we're here to serve the community, but they're so good to us.
Yeah.
So,
Yeah. And I know, Renee, wanted to touch upon and make sure it takes some time here to talk about, I know weather has been part of the conversation as well, and to kind of talk about what role CROI has, with, severe weather that impacts a lot of things. Yeah. What's that like? And tell us how you work with.
But it's interesting because for 100 years, we've been figuring out how we serve people in the community when we can't reach them, right?
Yeah.
So what does that look like? So we do have a whole emergency preparedness program within the organization, but and the clinical teams all get together and figure out, who if we can't get to them, who are we going to discuss with fire, police, or EMTs to be able to assist us, or if someone loses power and they're on oxygen. So we have all these plans in place, right? But I do want to stress that each town has fabulous fire, police, EMTs that can support us. So if we call them and say, we can't get to so-and-so's house and we really need to see them, can you help us out? And there's no problem. So even if they have to drive the nurse out to the house to see them. And in particular with our hospice patients, end of life, right? So we did still see our patients, less, of course, because we'd call people and they'd be like, please don't come, I'm not plowed out, I don't need a visit, I'm okay. But for the people that we needed to see, we got out and we saw them. And so that's what we do. But our community partners are so important to be able to support that.
Wow. Yeah, we have such amazing people in so many different areas, and it's good to know that, when you do need to depend on someone or need help, that there are people to reach out to. Right?
Absolutely. Yes.
Renee McInnes is the CEO of CROI Health, and we've also been talking to special guest this month, Dr. Nicholas Chiquez. Thank you, Dr. Chiquez, and Renee McInnes, thank you for coming in. And for more information, people can reach out and find out more on the website, right?
Absolutely.
And check it out. It's now CROI, CROIHealth.org, right?
Yes, that's right.
CROIHealth.org. Check it out, and you can find out, again, the partners you know and trust now. CROI Health, same mission, just a new name. And Renee McInnes, as always, thank you. We'll be chatting again. We do this once a month on WATD. So thank you, Renee. And Dr. Chiquez, good to meet you again, and thank you for coming in.
Thanks for having me.